Hello, hello, hello. Welcome to another exciting episode here in Doctors Go Live. With me here, your host, Nina Cheryl Khan. And today we are talking about protecting your precious eyesight. Now, let's find out who is tuning in from. If you're tuning in, where are you tuning in from? And let us know in the comment section. And what would you love to find out about today's episode on protecting your precious eyesight? And if any of you have some problems with your eyes, what are they? Share with us. We're going to get right into it, okay? And as with every new episode, if you share this video out, you get to take part in our Doctors Go Live quiz happening right at the end of the show after the Q&A, where today you get to win some exciting prizes. I'm gonna share with you what they are, but they're definitely exciting and awesome. So take a guess. Yep. Okay. Welcome, Zarina. Welcome, welcome, welcome. Okay. So all this is happening right here on Doctors Go Live with me, Nina, and our special guest for today is none other than consultant ophthalmologist from Columbia Asia Hospital, PJ, Dr. Syamil Mohamad Salmi. All right. Now, before we start today's episode, I would also like to find out from you guys. We've been covering so many episodes, so many different topics in Doctors Go Live. So what would you like us to cover in future episodes? What topics, what illnesses? Feel free to let us know what you would like in the comment section throughout the show, and we will cover this. We'll try and cover it in future episodes. All right? Sounds good? Let us know in the comment. Okay. Now, for today, though, today, we are talking about our eyes. They are the window to our world. And are we keeping them safe? Just like our bodies, our eyes too need some tender, loving care and to be protected from harm both internally and externally. All right. And that's what today's episode is about. We at Columbia Asia are going to open your eyes to the importance of eye safety, where today we're going to share some practical tips for protecting your eyes, not just at home, but at work and during sports and recreational activities as well. Sounds good? If you think this is awesome, let us know in the comments section. And if you know someone out there who would love this information, they would find it super useful, and if you think it's such an important topic, it's going to make a difference to somebody out there, please share it out. Tag your friends, follow us on our social media, because this episode is definitely going to make a difference to somebody out there. You never know, you could actually save somebody's precious eyesight, right? Okay, now, while you are sharing this video out, let's take a look at this video.
Your vision is precious, so your eyes must be appreciated and well protected. You should never take your eye health for granted. I'm Dr. Syamil Salmi, consultant ophthalmologist from Columbia Asia Hospital, Petaling Jaya, and I'm here to shed light on the importance of eye safety in your everyday life. Join me in the next episode of Dr. Go Live as we explore practical tips on safeguarding your eyes at work, home, and during sports or recreational activities. Your eyesight deserves the best protection, and I'll show you on how to ensure it. Don't miss it on next Wednesday at 3 p.m. See you then.
Hello, hello, hello. Welcome back. If you've just joined us, welcome to another episode of Doctors Go Live, where today we are going to share with you how you can protect your eyes, all right? Hello to everybody who's joined us. That's Azni, Zarina, David. Let us know who else is tuning in, right? And let us know what questions you have, all right? Now, we're here to unravel the secrets to protecting your eyes at home, the office, or whenever you're out and about outdoors. So today, please welcome consultant ophthalmologist Dr. Syamil Mohamad Salmi from Columbia Asia Hospital, Petaling Jaya. Dr. Syamil, thank you. Thank you so much for joining us. Okay.
Hi, everyone. Hi, Nina. Thank you for having me.
All right. So today, Dr. Syamil is going to be your guide so that your eyes stay crystal clear, because our vision is our precious gift, right, Doc?
Yeah.
Okay, awesome. Now, before we begin, just to remind, if you've just joined us right at the end of the show, as with every episode in Doctors Go Live, we have a quiz where we've got some exciting prizes. So please be sure to really listen to what Dr. Syamil has to share, because you could win some exciting prizes, all right? And of course, if you have any questions throughout the show with whatever Dr. Syamil is sharing, feel free to write your questions in the comment section. And yeah, Dr. Syamil will be answering it during the Q&A right at the end. All right. So let's get into it. Okay, Doc, before we begin, we would love to know more about you, because tak kenal tak cinta kan, like that. So Doc, could you share with us a little bit about yourself, what you do as a consultant ophthalmologist, and how did you get started into ophthalmology? What got you interested?
Okay. Thanks, Tina. Thank you for having me. Thank you again, and welcome to all the audience. I'm Dr. Syamil. My name is a bit lengthy. You can just call me Syamil. Dr. Syamil. I'm the consultant ophthalmologist in Columbia Asia Hospital, PJ. Recently, have joined the marvelous team of Columbia, and I've been practicing ophthalmology, I think, since 2016. Ever since I've completed my undergraduate, before that, and practicing the Ministry of Health, and then it captured my interest on the um, eyes, in which is such a small organ, but with a delicate anatomical structure. In which, do you know that, Nina, that the retina itself have 10 layers? It's around 500 micron, I think 500 micrometer, but it has 10 layers. It's such a delicate
Okay.
structure. We are not talking about the cornea yet and everything else in the eye. So these small organs, but with vast, interesting things to learn and to explore. So that captures my interest, and eventually I've continued. I pursued my study in ophthalmology in the University of Bangsa Malaysia. Then I've been practicing looking at patients with eye disease, and some people would confuse me with the optometrist, because they would randomly ask me to fix their eyeglasses. I said, I'm not an optometrist, I'm an ophthalmologist. It's a starking difference, but it's okay. I fix your glasses, I fix your eyes as well. Okay. So
So
that's
you can
about.
actually, so you do, does an ophthalmologist fix glasses? Well, no, it's completely different, right?
Kind of
Okay.
glasses, but not fixing your glasses, strengthening the screw. Uh,
Okay.
we just
That
look at
one
the
you
power, and then we let the optometrist fix the
do their
eyeglasses.
magic.
Yeah,
Okay,
correct.
got it. So you make you kind of identify what power and stuff like that, and then you pass it on to the optometrist
Yes,
to
and
do their
then
magic.
we exclude any pathology, any eye diseases, whether it's require the patient requires surgery or not. Okay, that kind of thing. But we
Okay,
work
got it.
closely together with the optometrist. We cannot work alone without the
I
optometrist. They are
see.
a good partner.
Uh-huh. So, okay, since you're bringing this up, does this mean that you have an optometrist in-house, Columbia Asia?
Yeah, we have a visiting optometrist in Columbia Asia PJ, but we also work together with the optometrists outside there. We
Mm-hmm.
refer to them, then they refer to us. So we work closely together.
Okay, so that's really good to know. Thank you for that
Yeah.
clarification. Now, since so today's episode, why is it important that we talk about today's episode, Doc? What are you hoping the audience will take home after today?
Okay, I think today's topic is very important in the sense that this topic is rarely discussed on air, especially those involving the industrial injury, as well as the sports injury, and also the domestic injury at home. So this topic is to protect our environment, so as to protect our vision afterwards.
Okay, because what is it that we don't know that you know because you see all these eyes all the time, right?
Mm.
Mm-hmm.
Okay, so the topic today is about
Mm-hmm.
identifying the common eye hazards in
Mm-hmm.
different kind of setting, at home, at
Mm-hmm.
our workplace, and our
Mm-hmm.
during our outdoor activities, whether it's sports or recreational. So by identifying these hazardous risks that pose the risk of injuring or harming the eye, we would we would have a protective measures that will help reduce the likelihood of having eye injuries. So
Okay.
okay.
All right, so that's what it's important. So we need to know what's out there, what could potentially harm our eyes, so that we are prepared,
Yes.
right?
Mm.
Okay, awesome. Because the more prepared we are, the faster we can come and get immediate help lah. Betul tak, Doc?
Yeah, correct.
All right. Okay, so if that's the case here, Doc, could you provide with us an overview of the importance of eye safety in our daily lives, both at home, at work, during sports, recreational kind of thing?
Okay, our vision is an integral part of our daily life. We cannot maneuver, we cannot move about without having a good vision, because it shapes how we experience the world and how we interact with the world around us. Okay, from the moment we wake up until we go to the bed, until we go to sleep, our eyes are working so hard that we can see the beauty and the wonders of the surrounding around us. But have we stopped and consider the importance of our eye safety and our daily life? That is why this topic is so important today, and then we will discuss and delve deeply into this topic and analyzing at every kind of setting, whether it's in our house, in our workplace, and then in during our outdoor activities. So these different types of settings and environment, by analyzing those settings, we would be able to minimize the risk. I wouldn't say to prevent once and for all, but at least we minimize the risk. Accident will happen, whether we are prepared or not, it will happen. But our role is to reduce or minimize all the possible risks so as to protect not just ourselves, but also our family, especially the children who are sometimes a bit uncontrolled.
Okay, and our loved ones lah, basically, kan?
Yes.
Okay, awesome. So, Doc, since we're talking about this, what are the common eye safety hazards individuals might encounter in different settings? How can they protect themselves? Yeah.
Yeah, okay. Now let's delve deeper into the topic of common eye safety hazards, which can
Okay.
pose a risk to our visions in various kind of settings. We've talked about home hazards, workplace, and outdoors activities. So it's essential for us to recognize and identify these potential dangers and take necessary precautions. So we go into our home setting first. Common hazards at home, which includes, firstly, I would say household chemicals, all the detergents, okay, pointed objects of furnitures, of table, and to our surprise, even children's toy. Okay, children's toy. Those are common hazards that we may neglect. Okay, but to our surprise, we still buy some dangerous toys to our kids. I like to share my experience. Do you know, Nina? Last year we have this film. It was a phenomenal, 𝘋𝘰𝘤𝘵.
Yes. Uh-huh.
Yeah, 𝘋𝘰𝘤𝘵. Okay.
How many of you
During
guys
that,
know about 𝘋𝘰𝘤𝘵? Let us know in the comment section. Yes, 𝘋𝘰𝘤𝘵, Doc. What happened?
okay, we have
Tapi I
this.
tak tengok lah.
This movie sparked a phenomena among the kids as well, not just the adults.
Uh-huh.
So
Uh-huh.
there was this kid who was playing with his brother. He has this fake small knife or keris lah, I would say.
Keris.
Then somehow he poked into his brother's eye. So we get a case of cornea perforation, meaning that the cornea, the front surface of the eye has been poked and breached, so that patient would later be brought into the operation theater, and we need to suture the cornea. So that's an example of how dangerous is a toy to our environment. So again, simple steps like storing the chemicals away from the kids, and keeping all the small objects safely, it can minimize the risk of having this kind of injury. Okay. To our surprise, again, okay, you know this hand sanitizer. Okay.
Yes. Uh-huh.
time and again we receive cases with chemical injury, because sometimes we press this hand sanitizer and then it splash into our eyes, causing chemical injury. So this is another kind of common eye hazards that we have to take safety measures at our home to prevent these kind of cases. Okay, enough about the home. Now we talk about the workplace environment. I think again we receive a lot of cases, especially those in the industrial area, in which they didn't wear these protective gears, such as the goggles, during handling the machines, as well as the welding machines. Okay, we time and again we receive patients with foreign body in the cornea that we need to remove. Sometimes they leave it for a few days, that in which that foreign body has penetrated quite deep, then we cannot remove it in the clinic. We need to go in the operation theater to remove it. So and then sometimes it has caused cornea ulcer, in which it takes months to recover, and then sometimes it needs suturing. Okay, so this kind of hazard need to be re-emphasized again, not just towards the employees,
Employee. Uh-huh.
but as well to the employers. So so as to provide a safe environment for all the staff. Okay.
Okay, got it. Doc,
Okay.
just a
Yeah.
question. The foreign object in the eye, they waited a few days. Is it because they weren't aware there was something inside, or they just didn't want to go because they thought it was nothing?
Kind of both. Okay,
Okay,
but
or takut.
they feel discomfort, but not to the extent of
I
seeking for
see.
help. But
Uh-huh.
after a few days, the foreign body has caused some infection, germs and bacteria
Mm-hmm.
has set in, so they feel more painful. So
Mm-hmm.
that is when they seek for treatment. And most of the time they will come late in the night lah, and after
Mm-hmm.
finished working, because they would think their work is the utmost priority,
Important.
important. So time and again they would neglect their eye health to a secondary level. So they would
Okay.
come a bit late in the night, and then
Mm-hmm.
we would need to rush and see them and
Mm-hmm.
remove the. We need to plan everything. Okay, so
Okay.
that's a bit. I think we need to have a good awareness on both
Mm-hmm.
sides.
Okay, got it. Obviously they are preventable, right, Doc?
Yes, yes, by having a
Okay.
good measures, safety measures.
Mhm. What about okay? Before we go into eye injuries, just want to clarify with people. A lot of people said that they haven't seen the 𝘋𝘰𝘤𝘵 movie. Not to worry. Basically, the gist of a movie, it's about a Malay warrior, I think, and they
Yeah,
have
yeah.
fighting scenes, and he basically fought with 𝘋𝘰𝘤𝘵. 𝘋𝘰𝘤𝘵 is like the local weapon kind of thing, or it could be any superhero movie where kids get excited, they watch, they
Yes.
learn, and they try fighting with toys with their brothers, but the toys end up being dangerous and got into the eye of the kid.
Correct.
Yeah, so those are the things we need to look at, right, Doc?
Absolutely correct.
Okay, cool. So now that we look at the eye safety hazard, what about injuries? Yeah, are there different types of injuries, and are they preventable? Just wondering.
Injuries, most of the time is preventable, but
Mm-hmm.
again, accidents happens. Okay,
Mm-hmm.
so by knowing how and recognizing the signs and symptoms is important. Again, when we have some complaint, we need to seek medical treatment.
Okay, okay. But Doc, how do we know? Because sometimes we don't think that these are safety hazards. So how, as parents or as caretakers, how do we be aware? Or as employees as well?
Okay.
Or we're covering that
There are
later?
symptoms. There are symptoms. We will talk
Okay,
about symptoms of eye injury. Usually,
okay.
there will be eye redness, okay,
Uh-huh.
and then eye discomfort
Mm-hmm.
or eye pain,
Mm-hmm.
and then there will be watery eyes, And then if the condition gets worsened, in which infection has set in, there will be discharge, swelling, okay. But usually, if the injury is so acute, patient will usually come and seek medical treatment, especially those involving the sports injury.
Okay. All right.
So, yeah.
Yeah. Okay. So let's go to the next one. What I think this is what you were talking about, right? What are
Yes,
some
yes, yes,
common signs and system of eye injuries? Yes.
yes. Okay, so when these signs appear, I think we need to seek immediate treatment. Okay, before we arrive at the front door of the hospital, there are few there are few measures or steps that need to be taken. I would simplify it into 5 steps. Okay, 5 steps. Okay, this is 5 fingers. So the first one is to ensure that our hands are clean and hygiene, so as not to further infect our eyes. Okay. Second is to avoid rubbing or touching the eyes. Okay. And to attempt removing any foreign body. I think I still remember last time during my childhood, if there's some debris inside my eye, I would open my eyes for about 30 seconds so as to wash out the dirt. Because once we open up our eyes, there will be reflex tearing, and that tearing will wash off the debris. But that's old stories. Okay, so again, hand hygiene, not to remove any foreign body. Don't touch your eyes. Okay, keep your eyes closed shut. Okay, and then fourth is, if it is involving a chemical injury, you may run warm water into the eyes for about 15 minutes. But please ensure that the water is clean, not some random water. Okay, clean water before reaching for medical treatment. And then the fifth is going to seek medical treatment and arrive at your nearest healthcare facility. Okay, so those are the immediate measures before if we encounter these kind of symptoms and injury, whether it's in our home, workplace, or during sports activity. And then finally, we need to seek medical treatment so as to exclude any serious condition.
Okay. Got it. All right. So that is with respect to signs and symptoms of eye injuries. Yeah. What about this here, Doc? What can you share with us about this? Especially now, everybody's using laptops, mobile phones. Are we seeing a new set of problems when it comes to eyes because of, with this new technology and stuff like that?
Yes, exactly, Nina, exactly. Because my experience in Columbia PGA, we encounter these kind of cases in which I would call it the proper term would be computer vision syndrome. Okay, we
What is
encounter
that?
computer vision syndrome. We encounter this kind of disease problems on a daily basis. Okay, because not just those people who works in the office, but I think everyone exposed to screen time, because we are handling with our mobile smartphones, televisions. Okay, so what happened is when we are too focused, okay, to the screen, we tend to get dry eyes. Okay, we tend to get headache, we get blurring of vision after a while, we get eye fatigue, eye strain, and then we get neck and shoulder pain. Why? Because our posture and our habit of seeing the screen cause us to have all these kind of symptoms. Okay, so what should we do? So consider this practice. Okay, first and foremost, remember this 20-20-20 rule. Okay, it's not to lose your weight, it's to relax your eye. Okay, so for every 20 minutes after focusing on your screen, especially your laptops, okay, or your monitors, take a break for 20 seconds, only 20 seconds, okay? Not 20 hours or 20 minutes, otherwise you wouldn't finish your job, okay? So break for 20 seconds and look for something far away 20 feet, okay? 20 feet, so it's around 6 meters, okay? Apart from that, perhaps we can maintain a good posture while seeing the screen, okay? And then don't forget to blink regularly, or you can also apply this kind of eye drops, artificial tears, okay? There are a lot of brand outside there. You can buy it from the pharmacy. Don't buy from Shopee or Lazada, because we need a certified eye drops. So you can buy it from the pharmacy. You look for artificial tears so as to relax and moisten and lubricate your eye surfaces. Okay, and then you can also adjust your screen not too bright. Okay, and then try to set a tag-free zone at your home. Avoid all the phones and laptops and computers and TV. Okay, and then spend some time outdoor. I think it's better, especially in the evening and once we finish our work, so as to avoid all this strain towards our eyes.
Right. So like a digital detox kind of thing.
Yeah,
Yeah,
exactly.
digital free times. I think we're so addicted to it. It's almost like drugs, they say. Yeah. Okay. So those are for people these days because we're so addicted to our phones and laptops. Yeah. In fact, how many of you guys have those symptoms described by Dr. Shamil? Let us know in the comment. I definitely get like that bright eye, blurred visions kind of thing.
Okay,
But
you should
yeah,
check your eyes. Okay.
is it curable, doc? Well,
Yeah. Usually, we provide we advise for some measures. Okay, it's curable and preventable, but need to adopt certain practices, especially the lid hygiene. Okay, and then artificial tears. I also usually provide eyelid wipes to my patients to clean
wow.
their eyelids. Okay.
Okay. Yeah. So Maureen is saying sometimes red eye. Yes, same. Okay. So that is with all these tech devices and stuff like that. What about what about for safety in sports? Could you share with us how do we manage eye safety in sports? Are there
Okay.
certain things we need to do? Yeah.
Yeah, exactly. Okay, I've put this picture of an ice hockey player with a complete safety guards towards the head and eye as well. Because to our surprise, okay, the ice hockey is a sports involving heavily contact sports, okay, and is prone to many kinds of injury, but the rate of injury for ice hockey is very low as compared to other kinds of sports. Why? Because they are heavily protected. Okay, you see the gloves, you see the eye gear, head gear, and then inside the shirt they have this another protective layer of shield. Okay, so if we were to categorize our sports into high risk and low risk, okay, so ice hockey would be in the high risk group. What about running? Is it high risk or low risk? What do you think, Nina?
I would think it's low risk compared
All right.
to
Okay.
hockey. Yeah.
Running, cycling, swimming, all of those are low risk activities, outdoor activities, because it's less contact with other persons and other objects. Okay. But sports like football, badminton, okay, hockey, basketballs, all of those are high risk sports that are prone or giving risk of eye injury, not just eye injury, other injury as well. But let's focus on eye injury for those kind of sports with high risk. Okay, so these kind of sports would cause blunt injury to the eye. Okay, so what do you mean by blunt injury? Sometimes it's the shuttlecock injury if you play badminton. Okay, time and again we get patients, especially during the Saturday night, when they play badminton with their peers. Okay, so they were present in our emergency department, having shuttlecock injury, being smashed by their friends. Okay, so by that mechanism, is a high velocity injury, blunt injury, not penetrating. Okay, so it's blunt. It's caused the eyeball to have a accelerating and decelerating injury. So there will be internal bleeding. Okay, the lens, internal lens, the origin lens would be sometimes dislocated, displaced. Okay, the patient might have vitreous hemorrhage or another kind of bleeding inside the gel of the eye. So a lot of injuries. Okay, we also get patients who practice martial arts. Okay, martial arts. It's a close contact injury, not just close contact. He was kneed, kena lutut by his partner.
Opponent.
So opponent. So this kind of injury would usually cause patient to have blowout fracture. What do you mean by blowout fracture? Because okay, this is our eyes. We have the roof, we have the floor, we have the walls, side walls and internal walls. Okay. So this is the floor. So the floor is the most prone or susceptible towards fracture because it's the most soft part of the bones. Okay, so when we have this blunt injury, high velocity causing high pressure inside the eye, it will blow out down here. Okay, so sometimes the muscle of the eye would be entrapped in that fracture as well, causing patient to have double vision. They cannot look up both eyes. One is restricted, one can go up. So those kind of problem arise from sports injury. So again, we have to protect ourselves during our outdoor activities. It's not to say we don't need to go out there and play sports and do recreational activity. We have to protect ourselves and protect our eyes as well. Okay, so I would recommend us to wear this protective eye gear, especially those who are playing professionally. Okay, make sure the eye gear is made of polycarbonate that is hard enough and not easily fractured. Okay, and those who are playing professionally or even in the amateur league, okay, I would recommend them to go for an eye screening prior to the event. Okay,
Okay, got it.
back to you.
Doc, but I have a soalan, yeah. So this is safety in these kind of sports, but there's a new sport called, all these computer gaming, and they spend hours online. How do they can't? I don't even know if they have time to do the 20 because you're competing with someone, right? And these are
Yeah,
long
yeah,
hours, yeah. And
yeah, yeah,
Malaysia is very good at it, you know. So,
yeah.
so what's your advice on that? It is a hazard, right? As well.
Yeah, I would advise to have a break as well. At least 20 minutes. You wouldn't lose the game if you break for 20 seconds, I mean. Okay.
Oh
Or,
yeah,
or
yeah,
do
yeah,
you
true,
lose
true.
if you break for 20 seconds? Maybe you can replace with your friends.
Maybe the organizing people need to
Consider this.
yeah, to consider this, or they have a pemain tambahan to take over macam,
Yes, yes,
a pit
yes.
stop kind of thing, right?
Yeah,
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 kind of
correct.
thing,
I
yeah.
think the organizer, not just
Uh,
the games
players,
organizer, but
yeah.
in fact,
Hmm.
all the sports organizers have to put the safety as an utmost priority on top of
Yeah,
other things. Okay,
yeah,
and
because
then provide. Yeah,
yeah, because I heard that you have all these beautiful clothes from India yang kena jahit sulam and money and
yeah.
all that. Those are actually done by children, and
Mm.
apparently because it's so detailed, they can only work up until they're 12 years old, then they're forced to retire because their eyes get really affected. So
Yeah,
so so there might be some work that some people do that affects their eyes. So
yeah,
I
yeah. I
guess
think
they
I think that's a good point as well.
mm,
Because these e-games, okay, because you are working in a near
yeah.
distance, okay,
Hmm.
especially those children who are heavily involved in e-games, I
Yep.
wouldn't
Hmm.
advise them to go. Maybe they should put a restriction. You cannot enter e-games at certain age because kids, if we expose them to near work only, and
Hmm.
then avoiding all the outdoors activity, they would be prone to have this myopia, or we would say nearsightedness, they would be difficult to see distant objects. Just imagine if they are exposed to this kind of games many hours per day, so they would end up having distant blurring of vision. Okay, end up
Okay.
wearing glasses. They cannot work as pilot. Okay, they cannot enter the army or
Yeah. Okay, so that's the thing. Okay, Doc, since we're talking about that, how do we know if we have an eye injury? Because you mentioned some people, they might not be aware that it requires attention. Are there cases where people actually ignore it, and why?
yeah. Okay.
Okay.
I think again the symptoms. If we
Mm-hmm.
have these kind of symptoms, redness, discharge, blurring of vision, we need to seek attention. Okay,
Mm-hmm.
uh, I have this case, interesting case.
Please
Last
do
time,
share. Mm-hmm.
yeah, this patient is a retired teacher. He was teaching pendidikan jasmani. You know pendidikan jasmani,
Mm-hmm. Physical
the
education. Uh-huh.
physical activities. He was teaching rugby, coaching rugby players. You know, when coaching rugby, you have a lot of micro trauma, I would say, because you have this multiple high impact contact
Mm-hmm.
on a high frequent times. Okay, so when we are planning to do cataract surgery for him, but once we dilate the eye, okay, he has definitely cataract. But once we dilate the eye, we saw that the lens is unstable. Okay, it's dropping down already. So it's not going to be a straightforward cataract surgery. It requires the lens to be explanted first, going for another surgery to implant the eye. So this unfortunate patient underwent multiple surgeries. Okay, so this is to highlight that even though you don't have any symptoms of
Mm-hmm.
eye injury, redness, swelling, discharge, it's good to have it's good to have an eye screening prior to
Okay.
anything, prior at least an annual basis. Okay, so as to detect any weird things, any abnormalities in the eyes. Okay, and then most of the time also we detect glaucoma. Okay, glaucoma.
Mm-hmm.
Every patient has had this eye injury, sports injury, or accidents a long time ago, but they didn't seek for help. But that event has caused high pressure years to come, and then we noted that the optic nerve, the eye has became glaucomatous already. So
Okay.
it's reduced in function. It's irreversible. He cannot regain back his vision. Okay, so it's
I
good
see.
to have an regular eye checkup.
Okay, got it. So, what is glaucoma again, Doc? There might be people who
Oh,
don't know.
yeah. So,
Mm.
so, so glaucoma is a progressive disease. It's a silent disease. Okay, so that's why people call it
Oh,
silent thief of sight. It will
uh-huh.
erode. It will
Mm-hmm.
steal your visual field slowly. Okay, this is our visual field. We can see about, I think, about 230 degrees apart. Okay,
Mm-hmm.
but as the disease progress, our visual field will become more constricted. Okay, as time goes, and then if it is advanced enough, we can only see tunnel vision. We can see only tunnel vision. Usually, because of this high pressure inside the eye,
Mm-hmm.
that compress on the optic nerve. Okay, inside our eyes, at the back of our eyes, we have this optic nerve. If it is being compressed for a long time, it will die eventually. Okay, just imagine we press our fingers, tip of our fingers, okay, for a long time. Eventually, it
Mm-hmm.
will die. Okay, it will become gangrene. Okay,
Mm-hmm.
it's similar like our eyes. If it is being compressed by high pressure inside the eye, it will
Mm-hmm.
die. And then when it died, then we call it glaucoma. Okay.
Ah, okay. So that's why it gets worse over time. Okay, got it.
Yes. Yes.
Okay, cool. Could you share with us about lifestyle and eye health, Doc? Are
Yeah.
there
Yeah.
any habits or practices in daily life that can contribute to eye strain or eye health issues, and what can we do?
Okay, regarding lifestyle and our daily habits, I would recommend for us, all of us, in fact, to at least stop smoking. Okay, stop. That's an
Mm.
important
It
thing to
affects the
consider.
eyes.
Yeah, yeah.
Okay.
Time and again, we receive elderly patient, especially who has been smoking during their youth. Some of them are heavy smokers. They have these degenerative changes inside the retina. Okay, the retina become degenerated. Okay, so what happens when the retina is degenerated? Retina is the most sensitive part of our eyes. If everything inside the eyes is normal but the retina is not normal, so the eyes would become reduced in vision. Okay, so what happened when we smoke, there will be a lot of leakages inside our eyes, which inside the retina, which cause it to swells up, and then patient, especially those elderly, may require some injections. Okay, some intraocular injection, meaning that we need to inject the eye to absorb the leakages from the retina. Not just the retina changes, people with diabetes, okay, who
Mm.
is also smoking. So the rate of recovery is a bit slower, okay. Regardless of how many times we treat them, we laser them, we inject the eye, okay, but they are still smoking, so that would reduce the likelihood of recovering and getting better. Okay, next is to have a good and balanced nutrition, which
Mm-hmm.
is vital to maintain the health of the retina, as well
Mm-hmm.
as the cornea. Okay, we will talk about it in detail on what are the good nutritions to look for. And then the next habit or lifestyle that we need to give attention to is our sleep. Okay, we tend to neglect the importance of adequate sleep. Okay, but poor sleep, meaning that inadequate sleep, can lead to eye strain, dry eyes, discomfort, fatigue, okay, redness, dryness. Okay, so it's important not just to have good nutrition but also good sleep. And lastly would be to keep ourselves well hydrated. Okay, drink a
Okay.
lot of water. So these are the measures that we need to consider in our lifestyle.
Okay. Okay. Wow. Okay. Did not know that even sleep and as well as what do you call that? Sleep as well as the other
Nutrition,
thing was yeah and drinking water
smoking,
was
yeah.
important. Yeah, and smoking as well. Wow. Okay. Another question, yeah, doc. Does age play a role? Does it matter if you're young or old with respect to eye health kind of thing?
Yeah,
Is there
yeah.
anything we need to pay particular attention to for the younger kids or our older parents or as we age?
Yeah, I think age is an important factor to consider.
Mm-hmm.
Children and elderly, especially.
Mm-hmm.
Okay,
Uh-huh.
children, because they don't have this self control. If we give them the smartphone or laptop, they will play throughout the day. Okay, so then they don't have this self control. We have to put some regulations to them, so
Mm-hmm.
as to set a reasonable time for them to play the phones, or
Mm-hmm.
some parents only allow their children to play with the gadgets only over weekends. Okay,
Mm-hmm.
these are important, as we discussed earlier, to prevent myopia. Myopia, what is myopia? It's a nearsightedness, meaning that we
Mm-hmm.
can only see near, but we cannot see distant. Distant will be blur. Okay,
Mm-hmm.
so if we expose our kids who does not have these self regulations, okay, uh, and then we didn't impose some time limit to them, they would end up having myopia, nearsightedness,
Mm-hmm.
meaning that they
Mm-hmm.
have to wear thick glasses which would cause them to have put them at risk for other kind of diseases, such as glaucoma, okay,
Wow. Okay.
and then cataract as well, okay, and dry eye. So for kids, I think we have to emphasize again about the screen time,
Mm-hmm.
and then especially for those who are preschool age, at home, especially if they are running here and there, we need to child-proof our home. Okay, again, we've
Mm-hmm.
talked about the toys. We talk about utensils. Okay, Nina, do you eat satay?
Yes, I love satay.
Do you love satay? I think
Yes,
all of
ni
us
muka
love.
satay.
Okay, you just imagine a kid eating satay, and then they meet their cousins, their
Yeah.
friends, and then while eating the satay, and then they run towards their friends with this lid. Okay, lidi.
Mm-hmm.
I'm always anxious about that kind of events. Okay, because
Mm.
time and again we receive patients who
Emergency.
accidentally poke their eye with
Satay.
pencil,
Oh,
satay,
pencil.
those kind of things, and
Wow.
sharp objects. Okay, so we need to proof our home as well. Okay, and
Mm.
then don't forget, for our kids especially, don't forget to bring them for regular eye checkup. Okay,
I
not just
see.
for us,
Mm-hmm.
children especially, because they are exposed to screen time. Maybe during our time it's not so obvious, but during their time, okay,
Mm-hmm.
we need to bring them to a regular eye checkup, even though they don't have any complaint. Okay,
Right. Okay.
time and again, once we bring them to an eye checkup, then only we know that they have this blurry of vision. Their vision is not optimized. Okay,
Mm-hmm.
most of the time they need glasses. Okay, and
I
then
see. Okay.
if not, they need some regular annual checkup, so as to monitor and observe their problems.
Mm-hmm. Okay. So since we're talking about this, let's go into tips for maintaining eye health. I mean, we spoke about eye safety hazards, injuries, when to seek for help. Let's now talk about maintaining good eye health. And I think one of the things you shared is regular eye checkups, right? If you have any questions, by the way, this is for the audience, let us know in the comment. Feel free to ask at any time. So the importance of eye checkups. First and foremost, yeah, doc, when we talk about eye checkup, this is not the one where you go and check dekat kedai spec power. That's not the same, right? Just wondering.
Yeah.
Okay.
That one is to check for the power and the power
Mm,
of glasses.
okay.
Okay, but eye checkup is a different thing, because
Okay.
we are going to examine the eye thoroughly, and from the very front to
Mm-hmm.
the behind part or the back part
Mm-hmm.
of the eye.
Mm-hmm. And how
Okay.
important is this?
Yeah, okay. Because most of the time we encounter incidental findings, such as we talk about glaucoma. Okay, and then most of us, Malaysian, we have diabetes. Okay, so
Mm,
diabetic people will also have problems inside the eyes. We call it diabetic retinopathy. So
mm-hmm.
we have to bring our parents who have this kind of diseases for checkups. Okay, not just diabetes, hypertension, cholesterol, all of these diseases would pose the eyes towards certain race and certain diseases. Okay,
Mm-hmm.
so we also encounter patients with squint. Okay,
Mm,
sometimes we neglect the importance of regular eye checkup. Okay, because the parents back then, maybe they are not having a good awareness, or not aware enough, so that they tend to neglect their kids, even though their kids have this squint, the eye is
mm-hmm.
deviated. Okay,
Mm-hmm.
so the kids end up having lazy eyes. So what is lazy eyes? I
Mm,
think a few weeks ago, I got this patient, brought this kid, 4 years old girl, brought in by the father and by the parents, complaining of blurring of vision. So when we check both eyes, one eye is squinted. Okay, so this kid has been having this kind of condition, squint eye, for 2 years already. Okay, it's quite obvious, but I think the parents maybe maybe the parents are in denial, so they didn't bring for help until it's very obvious. Okay, so but when we check the eye, the kid has already developed lazy eyes. What is lazy eyes? Meaning that the brain is now lazy enough to use that affected eye. Okay, so the affected eye is perhaps deviated, and then the fellow eye is straight. So the brain will use the normal eye, and lazy enough, and the brain will say, malas lah tengok guna that squint eye kan, lazy enough. So the deviated eye will end up having poor vision. Okay, so
Mm.
is preventable, okay, is preventable, and then is treatable. But once the lazy eye has developed, it's um, quite difficult and quite challenging, not just for the patients, because they have to wear glasses, they need to patch the eyes, they need to patch the better eye, okay, so as to
Mm.
stimulate the brain using the worst eye, deviated eye. So
Mhm.
it's also challenging for the parents as well. Okay, so the parents need to encourage, motivate the a 4-year-old kid wearing glasses, in which they would be teased by their peers and by their friends. Okay, so it's good to have a regular eye checkup across the age, kids,
Mhm.
adults, elderly, okay, male, female, all of us need to check our eyes regularly, at least once a year.
Okay, once a year. Yeah, for life lah, I guess.
Yes,
Kan?
yes.
Okay, so you touch a little bit about diet playing an important role in supporting healthy eyes. Could you share more?
Yeah, yeah. Okay. So, talking about diet, okay, it's important to have a balanced diet, okay, and rich in multivitamins, as well as omega 3,
Mm-hmm.
and having a good, I think, uh, green leaf vegetables. Okay, so all of these would provide nutrients towards the retina, so as to prevent what we have talked before about the degenerative changes in the retina, and to avoid having dry eyes as well. So all of these nutrients would supply good antioxidants and anti-inflammatory component towards the retina, as well as our tears. Okay, and then these kind of balanced diets will also prevent us from having cataract. Okay, sometimes people ask me how to delay cataract. I would say we cannot delay cataract because it's an aging process. We cannot reverse our age, but by having a balanced diet, we would somehow, at a lesser degree, delay the progression of cataract. Okay, so again, where can we get omega 3 component, antioxidant component? Maybe you can take it from fish, such as salmon, mackerels. Okay, multivitamins, vitamin C, especially from the citrus fruits, vitamin A from carrots, as we heard time and
Mm.
again. Okay, and
Good
then
for
nowadays
eyes.
we have supplements. Okay, ready-made, readily available supplements like lutein and zeaxanthin. Okay, there are a lot of brands outside there, but these are important some supplements that we can take to prevent degenerative changes inside our retina. Okay, so that we age gracefully, and then we can contribute to the society, even though at 70 years of age, 80 years of age. Okay, so,
Mhm.
and then because our nation is an aging nation, we are becoming an aging society by 2030. So we have to ensure not just the kids, not just the adult, across the age, especially those elderly, will be still functioning well visually,
Mhm.
uh, and then would be able to contribute to society even at the age of 80s,
Yes,
perhaps. Okay.
exactly. Okay, fantastic. All right. So, when it comes to eye health, yeah, doc, we've come to almost the end of the show. What's the biggest mistake most people make with regards to eye health and safety?
Okay, we've talked about it previously that okay,
Mm-hmm.
most of us practice this misconception. Sometimes if there's no news, it means it's a good news. Okay, so this is a huge misconception. Okay, even though we don't have any complaint, even though we don't have any problem in our eyes, okay, it's important, is crucial to just get the eyes checked up, okay, because most of the time most of the diseases are an incidental finding. Okay, we may not know until we get the eyes checked up. So the take home message would be get your eyes checked up.
Okay. Awesome. All right. Apart from that, Doc, at the end of the take home message is get your eye checkup. Okay, got it. I
Yeah,
never knew this. I always went to the optometrist to check power. That's it.
yeah,
Because
now
I
you know,
am
right?
guilty. Yeah, I am
Yeah.
guilty as a no news is good news kind of person.
Yeah,
So I think high time this year gonna check eyes. All right. What
yeah,
about you
yeah.
guys? If you have any questions, let us know in the comment. Or what about you? Have you been checking your eyes? I am very guilty. Okay, kind of thing. So that's what I learned. Okay, so now we're gonna go into Q&A. But if you find out today's episode is useful, please do share it out because we've got the quiz at the end, nanti. But let's go into Q&A first. I think we have a question from Madam T. Let me find the question. Madam T. All right. So, Doc, one question regarding Doc. You can see it at the bottom of the screen regarding BRVO, branch retinal vein oedema management. Is it appropriate for a patient with BRVO being left untreated since the patient refused to receive the management due to possible side effects? What are the possible side effects here, Doc?
Okay. If we talk about branch retinal vein occlusion, okay,
Mm-hmm.
so depends. Okay, it depends whether it involves the macula or not. Okay, so some patients with BRVO, they have this swelling at the retina, at the
Mm-hmm.
very center of the retina. We call it macula. Okay, the most sensitive part of the eye. Okay, light sensitive. If that part macula is swollen, so there are some available treatments. Okay, but not all patients with BRVO will develop this swelling. Okay, that's one point. The second is BRVO. We have to look whether it is ischemic or not. What do you mean by ischemic? Meaning that whether the blood supply to the eye has been affected or not. Meaning it is underperfused by blood. Okay, if it is underperfused, okay, you may need some treatments such as laser therapy. Okay, but if there's no signs of underperfusion, you may not need laser therapy, just a regular and timely observation and examination, perhaps monthly for the first 3 months, and then 3 monthly for the next 6 months, and then 6 monthly for the next year. Okay, to observe whether you have developed any other complications such as the macular edema and then the underperfusion, or we call it ischemic event. Okay, uh, it's a case to case basis. It's quite difficult for me to say it's okay to leave untreated. Depends on whether it is ischemic or macula has been involved or not. But again, get your eye checkup. It's no harm being checked up.
Okay. All right, awesome. So we hope that answers your questions. If not, you can ask a follow-up question in the comment section. Okay. Cecilia's question is: we've got Cecilia Chong. Does increasing font size reduce eye strain? Font size. Susahnya nak pronounce. Does it help,
Okay,
Doc?
tongue twister.
Huh.
Okay, difficult for me to pronounce, and I don't think so. I don't think so.
Okay.
Enlarging the phone, okay, tongue twister. I don't think increasing the phone
Font
font
size.
size we reduce eye strain. Why? Because okay, if you look at the we call it the letters. Okay, any gadgets with any screen with fonts. It's not the same as we printed it out on hard copy. Okay,
Mm,
because the pixels is a bit different. Okay,
mhm.
so studies shown that by looking at
Screen.
pixelated fonts in the screen would cause this computer vision syndrome. It's unlike people who read the hard printed newspapers and books. Okay,
Mm,
because you are going to strain your eyes looking at the pixelated, and then they have backlighting. Okay, how to reduce this eye strain? First, maybe you can
mm,
reduce the brightness. Okay, brightness.
mm,
Maybe perhaps by applying night mode, especially in the night lah kan.
mm,
I know most of us practice taking the blanket on top of our eyes and play the phones, so that would pose more risk. Okay, so make sure it's in night mode, reduce the brightness,
brightness.
as
Uh-huh.
well as reducing
Blue light.
the blue light. Yeah, the color
Ah,
setting.
okay. Okay. So that helps.
Yes.
Do you know how much to reduce it by? Just out of curiosity.
uh, some people said 20%, but I need to check again lah.
Okay. Okay.
It's
Reduce
too
it to 20% or
No,
by 20%?
it reduced the harm by 20% lah.
So 80% lah jadinya.
Yes.
Okay, got it. Okay. Natasha Bella has a question. Is looking at the color green really good for the eyes? And my question would be, is it looking at color green or looking at pokok green?
Yeah,
Which
I
one?
think I think that's a good advice or tips
Mm-hmm.
from our elderlies. Okay, but I think the thing is to look at a distant object,
Mm-hmm.
be it green, yellow, or any other colors. Okay, as long as it's a distant object, it will help to
Reduce eye
reduce the
strain.
nearsightedness. Okay, so
Okay,
we
got it.
practice to look at the near object. So that's why it's important to encourage our kids and ourselves to get some outdoor activities.
Okay, awesome. Okay, SPN has a question. Hi, SPN. Okay, and her question is, hi, doctor. Is it recommended to do LASIK? Which one is it?
Okay. LASIK,
Mhm.
LASIK is a refractive surgery, meaning that it's a advanced technology in which it will thin out the cornea, okay, to treat the nearsightedness or short or long sightedness. Okay, meaning that it treats the refractive error. Whether it is recommended or not, you need to get checked up first, and okay, because not all patients, not everyone who wears glasses are suitable for LASIK surgery,
Mm,
and then not everyone who does not wear glasses requires a LASIK surgery as well. Okay, so again, get your eyes checked out first. Okay, and then only we know whether it is recommended to do LASIK or not. Bear in mind as well, okay, bear in mind any surgeries, okay, not just LASIK, any other surgeries, whether it's is implantable columnar lens,
mhm.
cataract surgery, clear lens extraction, it is not without risk. Okay, it is not without risk and it is not without complications. Okay, so we need to weigh the risks and benefits. Okay, if we don't require it, don't go for it. If we require it, okay, consider the benefits and risks. Okay.
Excellent answer, Doc. Okay. Before we continue, now, if you found today's episode super useful, do let us know what you would like us to cover in future episodes, what topics, what illnesses, so that we can get them ready for you. Okay. Let us know in the comments section. And while we're waiting for you guys to let us know what you want to see in future episodes, let's go into the quiz. All right. It is quiz time. That's right. And as mentioned in the earlier part of the show, we have some exciting, amazing prizes up for grabs. But what do you need to do? first, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everyone can see it, okay? And next, answer 3 questions that we're going to be asking you. We're going to show it on the screen in a single comment, and you are on your way to win the prizes, all right? Let me repeat that. First, share the video out 3 times, and remember to set the post to public so everyone can see. And secondly, answer the 3 questions in a single comment, and we will select the winners based on the correct answer and shared post. Okay, got it? Are you ready? Let us know in the comment section. Now, the first question is... Hey, okay. The first question is, tak apalah, sneak preview. If you guys got it, you got it. Okay, first question is, redness, pain, and reduced vision are symptoms where immediate medical attention is required. Benar atau tidak? True or false? Okay. Rule 2020 is to help you lose weight. True or false? Children's vision is the children's problem and responsibility. True or false? So let us know the answer in a single line, whether it's true, 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 or false, 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 or whatever it is. All right. Let me repeat the question. Redness, pain, and reduced vision are symptoms where immediate medical attention is required. True or false? Rule 2020 is to help you lose weight, true or false? And children's vision is the children's problem and responsibility, true or false? All right, while we're waiting to get our team to find out who are our winners, let's go back into some Q&A, okay? So next question is David Wu. Hi, doctor. How to know our eyes having unusual pressure? Macam mana ya, doc?
Okay, what is the normal pressure of the eye? Okay, normally eye pressure is between 10 to 21 millimeter mercury. Okay, it's quite difficult to self measure or self determine the pressure. We can only objectively measure by visiting the ophthalmologist so that we can measure the pressure. Okay, but if it is sky high, if the pressure goes up to 60, 70, you can feel the difference. Okay, let's say my right eye here is 60, left eye is normal. Normal means 15, 15 kan. Okay, so you try to press both eyes. If you feel this eye is stony hard, keras macam batu, so means the pressure is super high. Okay, it has gone to 50, 60, 70, 80, 90. Okay, and then you compare with it should be firm, not too soft, it should be firm. Okay, if it is too soft, it has gone below 10. Okay, so that's how we roughly measure the eye pressure, but in order to measure objectively, we need to visit the ophthalmologist. The problem with eye pressure is patient with glaucoma, because the pressure is high, but not high enough to cause any pain. If the pressure goes up to 50, 60, 70, it will cause pain, and then the eyeball is hard enough. But problem with glaucoma, the pressure is about 24, 27, 28. It's not high enough to cause any pain, and then so that we tend to get patient with advanced glaucoma. By the time they visit us, the pressure is 27, and then it has caused the optic nerve to become glaucomatous and reduce visual field area. So again, get your eye checkup.
Okay, so basically get your eye checkup. That's the best thing. Okay, so we've already got our winners, but I want to cover a couple of Q&As first, so we can do this Q&A very quickly, yeah, Doc? So Cecilia has another question. Do blue light glasses help with digital eye strain? Glasses.
Blue light glasses, or do you mean blue light filter? I think blue light filter kot, kan?
Blue light filter glasses lah kan? I have one. So does it actually help?
Yeah, it helps in preventing the UV light. Okay, so the UV light also pose some risk towards our eyes. There are a lot of diseases that can be caused by this UV light. So it's good to have this blue light. But again, it costs some. It's a bit pricey lah if you go to the optometrist.
Okay, well, since you're saying blue light is good, I'm gonna blue filter is good. I'm gonna wear mine.
You look better without glasses, Nina.
Oh, darn. Okay, but I'm trying to protect them, Doc. I'm trying to follow
Okay,
what you
okay, okay.
say.
All
Okay.
right.
Okay. Next question is from Maureen. After LASIK, is the correction for the eye 100%?
Okay, for LASIK, okay, it depends on how the ophthalmologist is going to correct your eyes. Okay, if you are young, if you are young enough, so perhaps the ophthalmologist will correct the eye 100%. But if you are at the age of approaching, we call it 40 years old, approaching presbyopia, the ophthalmologist may not correct the eyes 100% so as to leave certain degree so that you can have this near vision after you reach age of 40. Uh, if people going for LASIK at the age of 45, 50, perhaps later in years to come, they would develop cataract. Okay, usually people at the age of 50 plus, they would start to develop cataract. So it may not correct your eyes for a long time. If you would want to go for LASIK surgery, go at an early age.
Go for an early age. Yeah, then you will have lasting
Yes, yes.
results of the surgery.
You
Yeah.
appreciate it more. Otherwise,
Yeah.
you end up
Okay.
with cataract, you end up with presbyopia.
I see. Okay. Okay, next question is from Jasmine Adam. Dari umur berapa untuk bawa anak-anak untuk regular check-up and sekerap berapa kali? Sekerap tu 1 tahun sekali ya, Dok? And how early can we check?
Yeah.
Mm,
Usually once a year enough
okay.
lah. How
Okay.
early? I think
Mhm.
at least the preschool age before going to school. Okay.
Preschool tu berapa ya, Dok? 2, 3. I
Uh,
tak ada anak, sorry.
45 lah, 45 pun
Empat
boleh.
lima. Okay,
Uh,
so se-early
5 years old is
45.
the sweet age lah kot. 5 years old.
Okay. Got it.
Okay.
Okay.
But
Compared
again,
to me, I guess 5 is very good.
good. But again, if you
Kan?
notice that your kid have some eye problem, even though if it is not true, if you think that your kid have this occasional deviation of eye, but when you check with the doctors, it's quite straight enough. It's okay. Don't worry. You can just bring your kid even at the age of 2 years, 3 years. Can it's better to get it checked up rather than later.
Okay, Doc, she has a follow-up question. Seawal berapa tahun untuk correctkan squint eye? So early as possible ke?
Okay, yeah, it depends. Okay, whether the patient has developed lazy eyes or not. Okay,
Mm-hmm.
if before 2 years old, and then the kid is at the verge of having lazy eyes, the vision
Mm-hmm.
is affected, and then the screen is not alternating, is quite constant. So they may need an earlier surgery so as to preserve 3D vision and then binocular single vision, meaning that we seeing with both eyes.
Mm-hmm.
Okay, so when we see with both eyes, it's not just seeing both eyes. We develop this 3D vision. We know the we call it stereoscopic. Some objects are nearer, some objects are farther away. So this kind of 3D is preserved before the age of 2 years old. Again, get your kids checked up, okay? Then we can advise the best, okay?
Okay, so
Whether to
bawa
do
as
surgery or
early.
not.
Yeah, bawa as early as possible. So since we're on the topic of squint, Maureen has a question. Squint can be corrected. I think you answered before, but let's quickly answer
Yes,
this.
yes. Screen can be corrected,
Mm-hmm.
especially before the lazy eyes
Set
develop,
in. Uh-huh.
sets in. But
Mm-hmm.
if the lazy eye has been set in, meaning that patient has surpassed the developmental age, meaning
Mm-hmm.
that if a patient is already 17 years old, 20 plus adults, okay,
Mm-hmm.
but have this screen, okay, it
Mm-hmm.
can be corrected, but it's a cosmetic surgery just to
Oh,
straighten the eyes. It's not
I see.
to preserve the vision because
Okay.
the function is already lost.
Okay. All right. So before 17, it can be corrected without surgery. Is it?
Before lazy eyes, before lazy eyes.
Before the lazy eye. Okay, got it. Okay. Next question is from
Banyak
Jacqueline
soalan.
Jancy. Hi, doctor. When is the best time to change spectacle?
When is the best time to change spectacle? Once you feel your vision is uncorrected with the current glasses, or your glasses is not fancy enough up to the current trend, then you get your spectacles changed lah.
Okay, got it. And next question from Natasha Bella. This is a good question. Can eye massages, I didn't know are there eye massages, improve
Okay.
vision and eye health?
Eye massage. What do you? There's no such eye massages that improve vision or eye health. The only thing we have, we are practicing eye massage is when we have this specific condition. We call it central retinal artery occlusion. Okay, when this condition develop, then the doctors will ask the patient to massage the eye for a specific time and specific condition only. Otherwise, they would. I don't think it's a good practice to massage the eyes to improve the vision and eye health. Perhaps we can massage our head
Okay.
to relieve all the stress.
Okay, Natasha, I hope that question answers answers your questions. Okay, Maureen Lam, your next question is: does eating wolfberries help?
I'm not sure what is wolfberries. Okay, what is the condition? What is the ingredients in wolfberries? But okay, keep in mind, as long as it contains vitamins A, D, A, B, A, C, E, D. Okay, and then as long as it contains other supplements such as omega-3, other antioxidants, good enough. But bear in mind, don't overdo it. Don't overtake the wolfberries.
Supplements. Okay, everything in balance. Yeah,
balance.
Because if we
Balance is the key.
Yeah, which I'm not really good at. It's something I'm learning. Okay. Alexis Bong, your question is: what are the possible drawbacks associated with wearing colored contact lenses, and what strategies can I employ to reduce discomfort? I used to wear colored lenses and my eyes would become fatigued after a few hours. Yes, doc.
Okay, this is another huge topic. Okay, contact lens related eye condition. Okay, contact lens is fancy. Okay, people like to wear it. Okay, but it poses certain risks: dry eyes, cornea ulcer, contact lens, tight contact lens syndrome, problems with the eyelid. Okay, if this kind of conditions develop, so you may need to restrain from wearing contact lenses. It's not good to wear contact lenses if you have these kinds of problems. Okay. Another thing to keep in mind is that having a good practice of handling the contact lenses. Okay, it's not just about the color. Okay, it's about the proper handling, meaning that where do you store your contact lens? Don't store it in the toilet, in which there are a lot of germs. Okay, because they love this humid environment. Okay, and then the solution you don't buy it from Shopee or Lazada. Buy it from an authorized or certified pharmacist. Okay, don't go swimming with your contact lenses on. Okay, and do you do that, Nina?
No, I don't wear. I mean, I used to when I was younger for blonde, purposes and for beauty purpose. Tak ada power pun.
Then don't wear your contact lens for a long time. Okay, don't sleep with your contact lens.
Some people
it's supposed
sleep.
to be. Yeah.
I'm surprised no infection.
It brings a lot of infection. And then bear in mind that contact lens related cornea infection, cornea ulcer. It requires a prolonged in-hospital stay to treat the cornea ulcer, and a prolonged treatment up to 3 to 6 months. Okay.
So if you guys want to look pretty, you want to use contact lens, the basic message is make sure you take care of it and the hygiene of it, or you're going to be having a prolonged stay in the hospital.
Don't swim with your contact lens on.
Yeah, okay. So make sure you know how to handle it. Last question, which I found right at the bottom of all the answers. Madam T is it appropriate to use LASIK to treat Tolong help pronounce press.
Presbyopia.
Yeah, got it.
Presbyopia. So this presbyopia is the thing that we've talked about, meaning that at the age of 40 years old onwards, we tend to get near reading problem. Okay, so everything near tends to get blurred and difficult to read. Okay, is it appropriate to use LASIK? Presbyopia is not treatable with LASIK. You may need to use reading glasses, or you can go for clear lens cataract extraction, meaning you do surgery. You remove your natural lens, and then we can implant, I think, a multifocal lens so that it can treat. You can have a distant, intermediate, and near vision quite clearly.
Okay, so basically, LASIK is not the solution for presbyopia,
Yes.
right? Okay, thank you. I didn't know that. Awesome. All right, so we have our winners, but before I announce who our winners are, let's find out what are the correct answers to the quiz question, shall we? So, Doc Syamil, you're gonna help me help me with this by reading the correct answers. Okay. So the question is: redness, pain, and reduced vision are symptoms where immediate medical attention is required. True or false, Doc?
True.
Okay, rule 2020 is to help you lose weight. True or false, Doc?
False.
Okay, all right. Children's vision is the children's problem and responsibility. True or false, Doc?
False.
All right, so the answer is true, false, false. And let's find out who our winners are. The winners are Jacqueline Jancy Jimin, Zurina Omar, and Natasha Bella. Congratulations on all you winning. Okay, so what's going to happen is congratulations to our winners. We will be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. Okay, so thank you so much. Congratulations to our winner. And thank you so much, Doc, for today. I definitely learned a lot. You need to do eye checks once a year at least. If you think anything is a problem with your child or with your eyesight, go and get it checked as soon as possible. And
Eye safety.
yeah. Yes, eye safety. Yeah, eye safety, definitely. Yeah, and be sure to check your kids' toys and stuff like that. You never know, and
Yeah.
especially with kids, satay without the stick, if can, cabutkan, right? Because I'm a satay addicted person. Okay, so congratulations. What did you learn most from this episode? Let us know in the comments section. But for me, it's definitely those. Thank you so much, Doc, and a round of applause for our doctor. All right. So that's all we have for today. We hope you learned a thing or two. Let us know what you want us to cover in future episodes, and we'll be sure to cover it for you. Okay. So if you know someone who will find today's episode super useful, the tips, the info, the insights, or if you love today's episode, please share them out. Okay. You never know who you're going to make a difference to. And of course, give us a lot of like and love while you're at it. All right. Till then, take care of yourself and your eyes. Okay. And we'll see you, get it? See you in the next episode. Okay. Thank you. And bye bye.
Okay, thanks, Nina. Bye.
Bye.